The course you are starting to study is called Big Data Processing Techniques in Healthcare. The topic of the first lecture is Big Data in Medicine and Healthcare. Questions that are considered in this lecture. Introduction. Big Data, Theoretical Basis and Use in Healthcare. Background to the development of Big Data in Healthcare. Directions of application of Big Data technologies in biomedical research. Difficulties when working with Big Data. Historical development of Big Data. Conclusions. The world of Big Data is radically changing everything, and the use of Big Data technologies allows not only to transform previously used methods, but also to find new decision-making models that were simply impossible before. Outdated methods of data analysis and collection do not meet modern requirements, therefore, there is currently an increased interest in IT solutions in Big Data. The development of Big Data technologies and adaptation to new tasks is the goal of studying Big Data. The constant accumulation and analysis of large amounts of data allows you to create models with which you can conduct experiments, that is, researchers, benefiting from the data, get results of scientific value. By analyzing large amounts of data, establishing patterns, you can create an object model that can be used for a variety of purposes. Using the model, you can study the properties of an already described real object, as well as make probabilistic forecasts. The efficiency of using large amounts of data will help improve the healthcare system, in particular, when choosing the appropriate ways of treatment and diagnosis. In order to cope with the huge amount of data, new solutions are needed. Big data analysis can improve healthcare planning. Big data requires a revision of the existing approach, taking into account new technologies. The amount of data in fields such as biology, medicine, and genetics is increasing at an increasing rate. Medicine is one of the industries that is becoming a consumer of big data technologies. In connection with the acceleration of scientific and technological progress and the development of a new generation of technologies, it became possible to work with huge amounts of data. In 2018 alone, humanity has accumulated 33 zettabytes of data. It can be noted that 1 zettabyte is equivalent to the memory capacity of one human brain. Gartner defines big data as meaning large volume, high speed, and/or a wide variety of information assets that require cost-effective, innovative forms of information processing to improve understanding, decision-making, and process automation. For the first time the term big data was used in 2008 by the American editor of the journal Nature Clifford Clinch. He called the explosive growth of information flows. He referred to such streams all arrays over 150 gigabytes per day. The comparative advantage of big data analytics in relation to traditional analytics lies in the speed of processing large amounts of data, the absence of the need to sort information, and the ability to analyze incoming data in real time. On the contrary, traditional analytics requires gradual processing, pre-sorting and editing. Big data properties are characterized as 3 volts, volume, variety, velocity. The areas of use of big data are diverse. Product development, using data from social networks and the results of test sales, a decision is made to bring a new product to the market. For example, Netflix created the House of Cards series based on big data analysis. Prediction, big data analysis reveals factors that can help predict equipment failures. Machine learning, big data has made it possible to learn a machine, not to program it. Regulatory compliance, big data analytics can quickly detect fraudulent activity. Such solutions are being actively implemented in banks and tax authorities. One of the most socially significant industries for the use of big data is healthcare. Systems that allow you to work with big data are a unique tool in solving healthcare problems, since they allow you to analyze a large flow of information about patients, the features of the onset and course of diseases, the effects of drugs, forecasting the occurrence of epidemics, determine more effective treatments. In addition, the use of big data tools is especially relevant in healthcare due to the growing demand from patients for quality of service. Big data sources can be different data. From a medical point of view, the sources of data are social data media, Facebook, Twitter, LinkedIn, medical websites, apps. Data from tracking devices, from remote sensors, tomographs, counters. Transaction data, medical insurance data, billing transactions. Biometric data, fingerprints, handwriting, retina, X-ray and other medical images, blood pressure, pulse. Human-generated data, Dr.'s notes, paper documents, Dr.'s prescriptions. The electronic form of work in medical institutions has made it possible to track the relationship between drugs taken, their effectiveness, as well as other factors that are so important for pharmaceutical companies. The main task of using big data is to reduce the time and cost of developing new drugs and bringing them to the market through a multivariate analysis of their effectiveness. Now a doctor in real time studying the data received from many specialists involved in the treatment of patients with single diseases of technology can afford to rely not only on his own knowledge. And this will allow much better analysis of the effectiveness of the treatment methods used. Examples of the use of big data technologies are the creation of registers of patients with hereditary diseases to account for volumes and needs for drugs, to simplify diagnostics, and to search for hidden dependencies. The existing many restrictions on the dissemination of patient data impose certain restrictions on the possibility of such an analysis. For successful decision-making on the implementation of big data solutions, clear planning of initial actions is necessary. The cultural level comes down to understanding the possibilities that open up when extracting new knowledge from the accumulated data, and, as a result, increasing the cognitive ability of mankind. The scientific level is formed by mathematical methods of data analysis, which allow making discoveries in chemistry, biology, medicine and other disciplines. The technological level involves the reorientation of IT from computing tasks as the main application to the collection, storage, and processing of large amounts of data with the support of certain analytical methods. The directions of using big data in healthcare are reduced to the possibility of providing personalized medical care, increasing the level of diagnostics, epidemic prevention, treatment efficiency, and combating fraud in insurance medicine. Prerequisites for the development of big data in healthcare. PricewaterhouseCoopers, in its report Global Top Health Industry Issues, Defining the Healthcare of the Future, identified 8 factors contributing to the simplification of the healthcare system and its active progress. Use of artificial intelligence. Drawing up clear instructions for the use of artificial intelligence. Comfortable conditions for the patient. Transformation of clinical trials. Use of technology to distribute remote services. Formation of valuable medical technologies. Cybersecurity. Social factors, the level of income and education. Modern medicine is turning into a science, where large amounts of information about the patient allow specialists to conduct personalized treatment. This is a new model of medical care organization based on the choice of diagnostic, therapeutic and preventive means that are optimal for a particular patient, taking into account his genetic, physiological, biochemical, behavioral and other characteristics. Based on this, it can be argued that now any process in the human body can be observed and measured. Medicine needs convenient tools for processing, storing, and transmitting an array of data. The model of organizing medical care for people through the rational selection of medicines is the current direction of big data technologies. The Big Data Genome Project has set itself the goal of sequencing, or in other words reading a molecule, 100,000 volunteers to direct research into personal genomics and personal medicine. This study was developed at Harvard Medical School. As part of the project, it is planned to decipher the personal genomes of many volunteers. Their genetic data, along with records from medical records, will be available for further analysis. As part of the project, the decoding of the personal genomes of volunteers, whose genetic data, together with records from medical records, will be available for further analysis. The use of big data technologies in bioinformatics allows the use of computer analysis methods in comparative genomics. The Gene Pool project was created to search for biomarkers in the human genome, as well as to analyze and store the information obtained during research. With the help of biomarkers, it is possible to assess the general condition of the body, identify deviations and destroy a specific harmful gene. To determine the presence or absence of cancer cells, a special substance is introduced into the body, which includes a tumor marker, then it detects or does not detect infected cells. A biomarker can determine both the degree of tissue damage and the area of spread of metastases around them. As a result, these substances allow you to accurately adjust the treatment area and avoid the removal of healthy cells. The Gene Pool project uses the DNA sequence of a molecule that explains its structure to search for biomarkers. One human genome contains about 3 billion characters. Gene Pool systematizes the entire huge flow of data received. The use of big data technologies that decipher this data array and reveal patterns in the genomic world. With the help of big data technologies, scientists have analyzed the genomes of many thousands of people, sick and healthy. Based on the analysis of a huge amount of information in the genetic code, the system selects a treatment. For example, Alzheimer's disease depends on genes involved in the development of multiple sclerosis and Parkinsonism. Big data analysis can help identify the most clinically effective and cost-effective treatments used. For the pharmaceutical and medical sectors, early detection of a disease provides an opportunity to model future demand for their products. This is the basis for making decisions about investment in research and development. The most important task of improving the level of public health is the analysis of global patterns of morbidity in order to identify trends and patterns of morbidity at an early stage. A number of questions that have to be addressed when working with big data. Most of the data in biology and medicine are difficult to analyze due to the incomplete description of the phenomenon. Creative completion of the analytical model with the help of hypotheses is necessary. Both logic and optimal work strategies should be developed. The issue of protecting personal information of customers. Will people allow companies to process their personal data and, in general, all information received from customers? Technologies are needed to increase the predictability of time, resources, and the final effectiveness of data centers. A significant presence of unpredictable and random factors, especially in medicine, where a lot changes on the fly. If clients generate a large number of requests, then this leads to the sharing of data centers, which leads to the unpredictability of their work. Historical development of big data. India. The Indian market for big data technologies and services has grown significantly in recent years with an expected CAGR of 35.1% over the forecast period 2021 to 2026. The big data and artificial intelligence ecosystem has seen a rapid expansion, with many large and small players emerging over the past couple of years. As such, India is expected to become one of the largest big data analytics markets in the world with the best use cases and significant opportunities for data professionals in the future. A shortage of suitable talent has led to an increase in the number of analytics solutions as their acceptance comes from several industries such as BFSI, retail and many others. Consumer goods manufacturers, for example, suffer from volatile sales performance, lacking diagnostic analytics capabilities to determine what is causing poor performance or make accurate sales forecasts. At such a moment, the manufacturer does not have enough time and budget to develop their own data analytics team, so they turn to analytics outsourcing in the hope of a quick understanding. The generation of vast amounts of data has prompted companies to seek information such as customer segmentation, understanding preferences in each segment, tracking changes in behavior, and personalizing services. In addition, due to the growth in the use of the Internet, a huge amount of structured and unstructured data is available to organizations. Such benefits have prompted multinationals and large companies to analyze their big data for actionable insights. The Indian government placed great importance on big data as it was at the core of the Digital India campaign. The government has become a major customer of big data services in recent years. In 2019, the government announced many projects that rely heavily on big data services. The first project was announced in September 2016 when the government of India planned to use drones, artificial intelligence and big data to create a digital map of India. The government plans to have higher resolution images that will be up to 10 centimeters in resolution. Adoption of big data has been limited to either large firms or startups. However, the The core of the country's enterprises are MSMEs. According to the latest figures from the Ministry of Micro, Small, and Medium Enterprises, there are 50 million MSMEs in India, making it one of the largest MSMEs in the world. Given the fact that government and MSMEs rely on scalable IT systems and solutions, it is understandable that they are moving their processes, along with sensitive information, to the cloud. In the first phase of the COVID-19 pandemic, the Government of India launched a free application, Bridge to Health, to collect mobile phone records, artificial intelligence and big data to help identify individuals potentially at risk of contracting the coronavirus through contact with other infected patients. United States. The relevance of the use of big data in the United States is based on cost-effectiveness. A number of analysts are confident that big data in healthcare will generate an additional $300 billion in cash flow, primarily through lower healthcare costs. Some American scientists believe that even a small influx of investment in big data can significantly improve the standard of living of people. Back in the 90s, in the United States, individual medical societies have become involved in the creation and management of registries. In 1997, the American College of Cardiology created the National Cardiovascular Data Registry, NCDR, to formalize data collection and reporting on diagnostic catheterization. Since then, NCDR has grown to 10 different registries with over 15 million unique patient records spanning the entire spectrum of cardiovascular care. The American Institute of Cardiology, ACC, recently expanded the scope of its registries to the outpatient setting by creating 2 unique registries, Pinnacle and the Diabetes Collaborative Registry. Pinnacle is the largest outpatient cardiology quality improvement register that tracks data on coronary heart disease, hypertension, heart failure, and 15 million patient records. Data from the Pinnacle registry is automatically transferred to the Physician Quality Reporting System. The purpose of the newly created Diabetes Collaborative Registry is to bring together primary and special care physicians to improve patient care and management of diabetes. The continuous expansion and use of registry data will lead to significant changes in the provision of medical care. California scientists have proven that an elementary analysis of data from social networks can identify behavior that provokes the emergence of HIV, create a system of measures to combat epidemics. The same University of California has implemented big data technologies in the therapy of local hospitals. The system is programmed to constantly monitor changes in the patient's condition, calculates the risk of sepsis. Boston hospitals are also embracing big data technologies. When carrying out major operations, the risk of death is predicted. Sometimes, based on the proposed analytics system, a decision is made to postpone the operation to another day in order to stabilize the patient's performance. Among the first projects in the U.S. is OncoSpace, or Smart Database. Such a database stores all images of cancerous tumors of the neck, head, pancreas, information about the anamnesis of the patients themselves. The results of the application of this project showed that the efficiency and safety of radiotherapy programs are increasing. As a separate area of application of big data, it is worth highlighting the study of human DNA. In the U.S., there is a company called Affymetrix, which develops chips. Such a biochip is capable of analyzing hundreds and thousands of cellular processes simultaneously. The rise of big data in American healthcare is driven by a large influx of investment. President Obama also reaffirmed the importance of big data in genomics when he announced in his 2015 speech that he would provide $215 million for the development of tiered databases to stimulate interdisciplinary collaboration with a particular focus on genomics. In the U.S., large capital investments from public and private organizations are expected to lead to increased knowledge and application of genomics. Big data analytics is used not only for monitoring individuals, but also for research. The Healthy Heart Study from the University of California in San Francisco aims to uncover models for predicting heart disease, uncovering the causes of atrial fibrillation, reducing heart failure hospitalizations, and determining the impact of social media on heart health by analyzing up to 1 million participants over 10 years. The study will use big data analytics to answer these questions with real-time metrics from patient-wearing sensors, mobile apps, social media and a dedicated web portal. Thus, in the United States, the development of big data in healthcare is in full swing thanks to the exponential growth of available data. The success of big data analytics depends on sustained technological advances in information technology and computer architecture, as well as seamless collaboration and open data exchange between physicians, insurance payers, industry, and government. Europe. As is known from the data of the World Health Organization, France is in first place in the world in terms of health development. In the field of big data application in France in 2017, the SNDS data system was developed, which combines information on human health obtained from various sources. This system has become widespread not only in France, but throughout Europe. Its uniqueness lies in the ability to combine information on deaths, information on disability, databases of insurance companies. SNDS is available to government agencies and healthcare institutions. Data security in the system is ensured by the French Internet regulator, CNIL, which is based on the legislation on the protection of personal data. According to forecasts, the Internet of Things has a great potential for creating value in healthcare, rapid detection of diseases, treatment of chronic diseases, about 16 to 35 billion euros in 2020 to 2025. Norway is also already using big data systems in healthcare. A university hospital in the capital is using Power BI to collect data faster and improve research accuracy. All this contributes to the redistribution of funds for more priority medical tasks. China. China differs from other countries in that it has already started building special centers for big data analysis. In particular, the construction of a state center for big data in the field of healthcare is underway. The volume of investments in the creation of such a center amounted to $1 billion. China is currently building a large DNA sequencing center. The center will be used to collect information about the gene pool of ethnic Chinese. The project is being implemented by the state-owned Yangtze Group, Southeast University, and Nanjing Medical University. The center also plans to study genetic mutations characteristic of various diseases. Thus, the implementation of big data in healthcare still depends on significant data collection and timely analysis to determine the most appropriate basis for optimizing health, individual prevention, diagnosis and treatment of diseases. Most projects on the use of big data in healthcare are aimed at studying the human genome and solving the problem of timely detection of oncology. Summarizing all of the above, it is worth noting that at the moment, universities and research centers are mainly engaged in the implementation of big data projects in Russian healthcare. In the US, the subjects are not only universities, but also companies that provide investment support. In Europe, in addition to universities, public services are also interested in such projects. China, most likely, is in the first place in terms of the level of development of such projects. State corporations, together with universities, are actively developing big data in healthcare. Russian experience in implementing big data in healthcare. Thoughts about the possibilities of using big data in Russian healthcare first appeared in the 70s, the last century. Soviet scientists were engaged in the development of mathematical methods for medical diagnosis and prognosis. A key role in the development of research was played by the Scientific Council for Medical Cybernetics and Computer Technology, established in 1974, under the Ministry of Health of the RSFSR. Under the guidance of scientific advisor S.A. Gasparyan, the staff of the council was engaged in the development of healthcare informatization programs. The developments were carried out jointly with the Department of Statistics and Informatics of the Ministry of Health of the RSFSR. The research can be considered significant due to the geographical coverage of scientific institutions, centers, institutes. The Sklifosovsky Research Institute, the Pirogov State Medical Institute, and the Sechenov First Medical Institute were involved. One of the significant results of the work done is a system created for the diagnosis of melanoma, malignant tumor of the skin. The developed system makes it possible to distinguish melanoma from benign and premalignant formations according to the examination data. The Russian big data market in healthcare is developing mainly due to research centers and institutes, and there are quite a few companies that implement their solutions in real practice. In recent years, two groups have emerged in Russia involved in the development of big data in healthcare. The first group is part of the Information and Analytical Agency of the Moscow Health Department. This is the Data Analysis Center. The implemented projects of the center include the project Personnel Analytics. It provides information about working doctors and various indicators of their performance. In addition, at a lecture by E. Prokofieva, a representative of the Data Analysis Center, on February 18, 2020, it was announced that forecasting epidemics in schools, balancing therapeutic areas, recognizing lung cancer, etc., can be considered as planned projects. All projects are implemented within the framework of the Smart City concept. According to the Center for Regional Science of the Vienna University of Technology, a smart city is a city with conditions for the growth of human capital. Smart city is characterized by human-centeredness, accessibility and openness, protection of personal data. The analysis of medical data within the city is considered as a step in the implementation of the Smart City concept. The second group is part of the Department of Information Technologies of Moscow. The group is doing similar research at the city level. It is important to expand the scope of big data, as this will optimize the time and material resources spent on the development of new approaches to treatment, and improve the quality of training of medical workers. The use of big data is the key to the development of preventive measures in healthcare. In accordance with the HealthNet roadmap, a number of benchmarks in the field of big data were achieved in 2017. In particular, the Health Heuristics software platform was developed using big data technologies. The platform is used to collect the biometric data of athletes in order to organize training programs. The Russian market is characterized by a wide variety of IT companies specializing in the use of big data technologies. Such companies have great potential to enter the healthcare market. For example, Yandex, Abby, Kaspersky are leaders in the field of personal data protection. In accordance with the HealthNet roadmap in 2020 to 2025, the development of big data in healthcare is planned. The appearance of the first professional centers using software products for the purpose of continuous monitoring of the state of the body is expected. In 2026 to 2035, it is planned to create a whole network of such centers. As a Russian experience, you can also consider the HealthNet roadmap of the National Technology Initiative, initiated by the Ministry of Health of the Russian Federation. It should be noted that in Russia only the first steps are being taken to use big data technologies in the healthcare sector. In 2018, the administration of the Tomsk region, together with the Russian company Rubius, launched a project to analyze big medical data. In 2012, all medical institutions in the Tomsk region connected to the Unified Medical Information System, MIS. In addition to MIS, data sources also include the base of the Territorial Compulsory Health Insurance Fund and data on e-help calls. The project turned out to be successful. At the moment it is planned to train social workers to work with big data. In February 2019, a number of pilot projects in this area were presented at the annual Big Data Forum. For example, the IBM Watson Explorer system was trained to detect discrepancies in protocol descriptions and conclusions for patients who underwent radiation. Conclusion. The analysis of big data from self-reports and personal medical records, including medical tests, prescribed drugs, as well as tomographs, all kinds of sensors, provides the opportunity for dramatic improvements in healthcare. The amount of information requiring analysis continues to grow continuously. Availability, continuity, usability, scalability, ability to manage at various levels of detail, confidentiality and security of solutions, and data quality control are essential for effective data management. The use of big data technology is in high demand, as the latter will be able to solve urgent problems in medicine and a number of related fields. Given the exponential growth of data volumes and new tools for advanced data analysis, healthcare system transformation is possible. Therefore, the use of modern computer methods for solving these problems will significantly increase life expectancy in the future. The use of modern computer methods for solving these problems will significantly increase life expectancy in the future. So let us sum up. In simple words, big data is a lot of information, terabytes of information. It is a little more correct to say that big data is tools and methods for processing a large amount of structured and not very information. Information is collected in information processing centers, data centers. The data center is in the photo below. The larger the center, the greater the possibility of data processing. The more data scientists analyzing the data, the more opportunities the center has. The task of data centers: processing as much information as possible. The ability to quickly analyze incoming data. Search for non-obvious patterns within an impersonal data stream. Big data and apple pie. An interesting case study related to big data was shared by Kenneth Cookier during his TED Talk. While stores were selling pies 30 centimeters wide, the absolute favorite was the apple pie. But as soon as they started selling 11 centimeters pies, apple pie fell to 4 to 5 places in the preference rating. It turned out that when a family chooses one pie for everyone, the choice is obvious: everyone has an apple pie in second place. But if everyone can choose a cake for themselves, everyone chooses the one that comes first. Big data is a very cool tool with which people can develop. When you have more data, you can make more accurate choices. The data helps to see not only more, but also better, in a different way. To understand that apple pie is not a favorite pie. Who invented big data? Technically, big data has always been around. Any file cabinet or register is a kind of big data. The first libraries of Babylon in the 2000s BC, an example of how people first encountered the issue of storing and organizing a large amount of information. Even 10 to 20,000 years ago, the ancestors of modern man used bones to record stocks in order to conduct trading activity, analyze and predict food needs. Gradually, information began to be used for forecasting. In 1663, the scientist John Grant wrote the book Natural and Political Observations based on data on mortality. In the book, he described the theory that death data could be used to warn of the onset of an epidemic of bubonic plague. Unexpectedly for him, the book became the first statistically sound estimate of the population of London. With the growth of information volumes, difficulties arose with its processing and analysis. In 1880, during the census in America, they were faced with the fact that it could take more than 8 years to calculate population data. The businessman inventor Herman Hollerith came to the rescue. He created an electromechanical tabulator for punched cards, an electromechanical tabulating machine for punched cards, with the help of which, operating with punched cards, it was possible to process the required array of information 32 times faster, in just 3 months. Later, this invention was bought by IBM. Since then, more and more information has been added, and the issues of data storage and the speed of their processing are becoming more acute. What is the value of big data? Big data are valuable topics that reveal non-obvious patterns. Knowing these patterns becomes your competitive advantage. People are not inclined to analyze their every step and may simply not think about what they do in everyday life. You can consider science fiction more interesting than detective stories, but at the same time buy 5 novels in a row about detectives and not one about spaceships plowing the universe. Remember the story of the apple pie. Data privacy. Do not worry that big data is about what everyone in the world will know specifically about you. Scientists of the big data department work only with aggregated, depersonalized data. We are dealing with impersonal groups, and do not track the behavior of specific people. DLP systems, from the English Data Leak Prevention, are also responsible for the safety of data. They prohibit transferring data to the outside. Therefore, No one in any form will be able to track information about a particular subscriber, to find out what, for example, Vasily Pupkin was interested in. At the same time, it is easy to create an impersonal segment of people who are interested in buying real estate or planning a trip to an exotic country or move to a certain place at a certain time. Why big data is needed in medicine: gather information about patient studies, their analyses, behavioral characteristics, and treatments. It is possible to process prescriptions for drugs and understand, based on all the data, the characteristics of patients and the effectiveness of their treatment, and notify doctors before they plan treatment, which, for example, will turn into addiction for the patient or will be ineffective.